Hi, welcome back to another of our physiotherapy education series. Today we'll be showing you a step-by-step instruction on how to transfer a patient who has impairment on different parts of the body safely. A good transfer will ensure safety of both the patient and the caregiver. Proper body mechanics is necessary to prevent any unnecessary injuries to yourself and the patient. Always maintain communication with the patient to ensure each step of the transfer is coordinated. When transferring a patient who has undergone a knee surgery, for example a total knee replacement, it is important to ensure that the knee is supported as well as the patient is well supported during the transfer. Stand at the side of the operated knee of the patient. Next, assist the patient to a long sitting position. Get her to support herself with her hands. Gently support the operated leg with one hand and swing it over the edge of the bed, while the other hand supports the patient's shoulder blade. Remember to bend your knees and keep your back straight. Gently guide the patient to shift herself forward towards the edge of the bed. She may bend her good leg to help to push herself forward. Place the chair at about 45 degrees to the bed. Ask the patient to hold on to the armrest away from her. Have the patient straighten her operated leg. Ask the patient to hold on to the armrest away from her. Next, assist the patient into standing. If the patient is allowed to put weight on her operated leg, she may take some weight on her operated leg and shift herself closer to the chair. Once both the back of her legs can touch the chair, assist her to gently lower herself down the chair by first placing her operated leg slightly in front of the other leg. Next, she may place both her hands on the armrest and support her body weight as she sits down. When transferring a patient who has undergone a hip surgery, it is important to avoid excessive bending at the hip or crossing of the legs. Stand at the operated side of the patient, assist the patient to get into a semi-inclined position, support the operated leg and position it closer to the side of the bed. She may bend her good leg to assist with this transfer. Place the chair at about 45 degrees to the bed. Next, assist the patient into standing. If the patient is allowed to put weight on her operated leg, she may take some weight on her operated leg and shift herself closer to the chair. When transferring a patient with low back pain or someone who has undergone a back surgery, it is important to follow these steps. First, help the patient to bend both knees. Next, place both hands on the stomach and get the patient to perform a log roll onto the side. With one hand supporting the patient's shoulders, get the patient to push herself up with her hands while gently swinging her leg over the edge of the bed. Hi, we have come to the end of another physiotherapy education series. We hope now you have a better understanding of how to transfer your loved one safely. Should you have any doubt about patient transfer, do talk to a physiotherapist.